येस त्यांना तो पाठवायचा आहे ना नंतर. Hello friends, welcome to Acharya 90 FM, your own radio. Myself Tejaswini. Today we have two eminent guests in our studio, and we are Antibiotic Awareness Week is happening in Mumbai in the month of November. So in accordance with that, we have arranged this interview with Dr. Sirisha ma'am. Ma'am, welcome to Acharya 90 FM, and welcome to India. Welcome to Bombay.
Thank you very much.
And about Dr. Cecilia.
Cecilia,
okay. Cecilia. So I'll take it again.
Yeah.
Cecilia. Hello friends, welcome to Acharya 90 FM, your own radio. Myself Tejaswini. Today we have two eminent guests in our Acharya 90 FM studio. There is Antibiotic Awareness Week happening in Mumbai in the month of November. So in context with that, we have our guest today, Dr. Cecilia. Ma'am, welcome to Acharya 90 FM.
Thank you very much.
Thank you. And Dr. Ashok Tamhankar sir. Dr. Ashok
Hello.
sir, welcome to Acharya 90 FM.
Hello.
So let me introduce Dr. Cecilia. She is a professor, international health and Karolinska Institute in Stockholm, and she has a research. She's been the research group leader, global health systems and policy, more particularly medicines in the health system, focusing antibiotics. And as we know, Dr. Ashok Tamhankar sir had already been to our studio, and we had arranged a podcast with Dr. Ashok Tamhankar. But he is a professor of Emirates. He was a professor in Emirates in Acharya Marathe College, our own college, and he is a national coordinator, Indian Initiative for Management of Antimicrobial Resistance. He is a scientist affiliated to Karolinska Institute, and several joint research projects he has done with Dr. Cecilia. So now I would like to ask you, ma'am, about what exactly the work is going on in the Institute of Karolinska Institute.
Yes, Karolinska Institute is a medical university in Stockholm, Sweden, and it has 22 undergraduate programs. It has about 10 international master programs where we receive a lot of international students, and they are all taught in English. The undergraduate programs are in Swedish. And then we have research training, of course, since it's a medical university. We have about 2,200 PhD students, and around 350 of them defend their thesis every year. So you want to know anything more?
Yeah, sure. The knowledge is more important for our students and the professor also.
Yeah.
So we love to know more about what exactly the syllabus is, what are the subjects related to medical field. So we would like to know about it.
I'm not so much involved in the undergraduate education, so I cannot tell you very much about that. In our department, we are of course involved in the undergraduate medical education, but mainly we work with the master programs, the master program in global health, and the master program in public health.
Wow.
And then some other master programs that we are involved in as well, like disaster medicine, which is also a very important topic. So, but within research training, students can work very much according to their own interest together with their guide or supervisor, as it is called in Sweden. But I think guide is a much nicer term, because the idea of the guide is that he or she should guide the student in his or her research work.
Yeah. Now, Dr. Cecilia, I would like to ask you, you're working with AMR, that is antimicrobial resistance. Can you give a general idea what is exactly AMR?
Yeah, I mean, you use the term now AMR, which is antimicrobial resistance, but I actually work more particularly with antibiotic resistance, because when you talk about antimicrobial resistance, you include both resistance to antibiotics, and antibiotics, as we all know, they work with bacteria, bacteria that cause diseases. But within the antimicrobial resistance field, you also have resistance towards antiviral drugs, like HIV drugs. You have resistance against TB drugs, you have resistance against malaria drugs or antiprotozoal agents, and resistance against fungal drugs. But our focus is mainly on resistance in bacteria. And antibiotics, I mean, I know that antibiotics is maybe the most important group of medicine because they are really life-saving. But they are also used unnecessarily in many times because as I said, they work for bacterial infections, and most infections are actually not bacterial. So antibiotics are used in many cases when they are not needed, which is very unfortunate because then they will not work when they are actually needed, and they could be saving the life of your child or of your mother's life or your grandmother's life. So it's important to keep the antibiotics working for the cases where they are really needed.
And what happens to antibiotics after we consume them?
I mean, when you put something in your body, it is either metabolized, that is, it is changed by the body in the liver, and it can then be excreted from the body, or it goes through the body unchanged. And with antibiotics, it's about half of the activity, you can say, is maintained even after it has gone through the body. So there will be a lot of antibiotic residues in the environment, which is also a very big problem.
That's
I just was thinking that you said antibiotics are used in a very large way, and you specifically apportioned the organisms like virus and fungi and etc. Very recently we had COVID epidemic.
pandemic.
Was it bacterial or was it?
No, COVID, that is a virus.
Virus,
That is a virus. So antibiotics have absolutely no effect in COVID. And in Sweden, actually, the antibiotic use, it dropped drastically during the COVID pandemic because there was very little co-infection between the COVID virus and any bacteria.
Yeah, but then what we have seen in India is that antibiotics were used very widely during the COVID epidemic. And so what is your take on that? How to stop this? What can we do about it?
Yeah, I mean, there are many different answers to that. And directly in relation to COVID, in the beginning when COVID came, nobody knew really about COVID and how to treat it and what to do. And there were some studies in the beginning trying different medicines, among them some antibiotics. And it was shown in those studies that they were not effective. But still, just that the studies were done, that made prescribers prescribe those medicines. So it was sort of a misconception, you can say, that a lot of antibiotics were used.
Do you think the resistance in bacteria might have increased because they were unnecessarily exposed to antibiotics during the COVID epidemic? Well, really speaking, COVID was not getting controlled by the use of antibiotics.
Yeah, of course, extensive use of antibiotics, that is one of the factors increasing resistance. So yes, absolutely.
Yeah, so what do you think? How we can control the situation where if I go to a doctor, the doctor normally prescribes antibiotics, and very, very commonly they are doing it in several parts of the world, not only in India. And what measures do you think can be taken to control this kind of situation?
Again, there are many answers to that question. So I think we have to start a little bit from the beginning. Often a disease is caused by something. I mean, it can be because a virus, or in some cases a bacteria, have entered a body and then caused an infection. But I mean, it's not, the body has a lot of defense mechanisms themselves, so it's not necessarily so that you need to use medicines always. One thing which is very important is the awareness among people, and not only awareness about antibiotics or antibiotic resistance, but awareness about so-called normal diseases. What is a common cold? I mean, if people know that a common cold, it will pass in 7 or 10 days without any treatment. There is no need to go to a doctor if there is a common cold. But the difficult thing there for common people is to understand when it is a common cold and when it is not a common cold. So I think awareness and what is called health literacy among the general public, that is one of the most important things actually to manage antibiotic resistance. And then of course also hand hygiene and other things to prevent infections. Because if there is no infection, there is no question about using antibiotics.
Yeah.
So
I just wonder, Sweden is an advanced country. So how the things are managed there with respect to controlling unnecessary use of antibiotics and also how to manage antimicrobial resistance. So we could learn something from you about how things are happening in Sweden.
Yeah. First of all, I think it's important to recognize that India and Sweden are two very, very different countries. So we cannot really just transfer anything, but of course we can discuss how things can best be done. And in some ways, Sweden and India are quite similar when it comes to the organization of the health system, because Sweden is a small country when it comes to inhabitants, but it's a quite geographically big country. So we have different regions, and the regions are in a way kind of not independent, but the health system is structured within the regions. So in Sweden we have something called STRAMA, the Strategic Program Against Antibiotic Resistance. So in each of the regions there are groups, multidisciplinary groups, that work with this issue. And they work both with the prescribers and other types of health personnel, with nurses, also veterinarians and pharmacists of course, and also with the general public to educate and to to do things within these fields. So I think in Sweden it is this multidisciplinary and local thing that has been working. So in Sweden now, in many cases, when a parent comes to the doctor with a child, the question from the parent is, if the doctor wants to prescribe antibiotics, is it really necessary that my child gets an antibiotic? Because antibiotics also have side effects. They have a lot of side effects. And but of course sometimes it is very necessary that the child gets antibiotic also. So this is the difficult thing, because you cannot say that you should not use antibiotics. You should definitely use antibiotics when it's necessary, but not when it's not needed. And this is the difficult thing with antibiotics.
Definitely. We'll take a short break and we'll continue our podcast. Friends, you keep listening Acharya 90 FM, your own radio. We are having a discussion on Antibiotic Awareness Week, which is happening in November. So we are discussing this topic with Dr. Cecilia and Dr. Ashok Tamankar. We'll join you after a short break. Thank you. 10 minutes झाली ना मग break.
Okay.
So now we'll continue.
So do you understand?
Now it's okay. When you were talking outside, I couldn't understand. Now I can.
आपण थोडं हे झालं, आता आपण पुन्हा कसं जॉईन करणार आहोत?
परत विश्रांतीनंतर स्वागत घेते. आपण तुमच्या मुलाखतीच्या वेळी ब्रेक घेतले होते ना, तसं.
No, I'm just trying to.
सारी
ठीक आहे.
पुढे होय. पाणी कोरड पडते. तुम्हाला हवं आहे ना? माझीच होत आहे ना ते.
आता असं झालं की तुम्ही मी विचारणार होतो ते बरेच क्वेश्चन कव्हर केले आहेत, तर आता मी तुम्ही विचारणार होतात ते पण क्वेश्चन घेतो मधून. ठीक आहे, ॲज वी गो.
चला, ते आहे ना दादू. Welcome after the short break. We are listening to Acharya 90 FM, your own radio, and we are having a podcast, special podcast on Antibiotic Awareness Week, which is happening in November. So we have with us Dr. Cecilia and Dr. Ashok Tamankar. So, ma'am, now I would like to ask you, what is the situation in India and abroad? You can discuss upon that. You can put a light on that about antibacterial, all these medicines specifically.
Yeah, you mean the situation with antibacterial resistance in different countries? Yes, it's very different in different countries, but it's also so that we do not know so much actually, because in many countries when studies are done, it is patients in hospitals where samples are taken and the antibiotic susceptibility pattern is seen. And the problem with the patients in hospitals is that, I mean, they are in hospital because they are sick.
Yeah.
And they have probably been sick for some time before they came there. So probably they have taken antibiotics before they came to the hospital. So then their bacteria, because it's the bacteria who becomes resistant, not the person, it's the bacteria who becomes resistant. So then the bacteria and the resistance develops when the bacteria are in an environment with antibiotics. So then the bacteria have become resistant to antibiotics, and then what happens in hospitals is that they need to use more broad spectrum antibiotics, and then the resistance develops to those also. So what we see in many studies and what we see in some surveillance programs is also the situation in hospitals. But if we really want to know anything about the situation in countries, we also need to go outside the hospitals to the community and look both at patients in the community, patients with community acquired infections, but also in people in the community who are not sick at all, because there we really see the pattern of resistance in sort of so-called healthy people. That we don't know much about, but there are some studies here and there, and sometimes the resistance pattern is surprisingly low, and sometimes it's surprisingly high, and it can vary within countries, it can vary within geographical areas, so it's very difficult to give a general picture, except that it's very important to do such studies and to find out the actual situation. Yes.
No, but if we take in general, for example, so let us say, for example, Nordic countries or the Eastern European countries or Western European countries or USA or Africa or say Asia. Do you think there might be some difference in the situation in these countries, or it may be just a general picture? What's your
in Europe, we have something called the ECDC, the European Center for Disease Prevention and Control, and they collect data from all the European countries, both on antibiotic use and antibiotic resistance. And what we generally can see is that resistance is lower in the Nordic countries in the northern part of Europe. It's higher in the southern part of Europe, and to the east it is also higher. So here we have quite good data, because data has been collected more or less in the same fashion, and we have data both on antibiotic use and antibiotic resistance.
Yeah, it's very interesting that if you go to a pharmacy in Sweden, for example, whatever you take, it gets computerized and it goes into the central data. So every medicine, particularly antibiotic, that is getting sold or consumed, to which person it is going, there is a whole picture available of the whole country, and I think this may be true for other many Nordic countries also.
Like, but there I must interrupt you, because what we can see, as you rightly say, we see what is sold, but we do not see what is really consumed. But often in papers and when it's discussed about this, we talk about antibiotic consumption, but actually we see what is sold in the pharmacies, and then what is consumed, we have actually no idea about that. It can be the same, it can be something else.
Yeah, but at least we get a general picture about it.
Yes.
Because what happens in countries like India, there is no record at all. There is a very gross record, but here at least almost to every precinct or district or taluka, or what is the general picture that they immediately get, because there is
a prompt response.
Everything is recorded, which is very important. So that's what. And I also was wondering that since it's a worldwide problem, don't the world organizations at world level, what kind of approach is being taken, what's solution they are trying to find out, or what is the approach, what they are doing?
Yes, the World Health Organization has of course been working with this issue for a long while. Already in 2001 there was a global strategy published on antimicrobial resistance, but unfortunately it was not very much implemented, although it was very good. But then several things has happened over the years, and in 2015 the Global Action Plan on Antimicrobial Resistance came with 5 different objectives, where one objective is the awareness, increasing awareness among the general population. And then also every country was asked to develop their own national action plan, and if it's large countries also to develop sub-national action plans. And many countries are working with this. Many countries have developed action plans, but the problem in most countries, I would say, is money for implementation. And so that is really a problem globally.
Yeah. India has developed the action plan, and I think there are 3 states, Kerala, Madhya Pradesh and Delhi. They have developed the antibiotic action plan. Even Maharashtra is developing the antibiotic action plan currently. I have attended that meeting where they started doing that. So we are trying, in India also we are trying to take action on this particular matter. The thing is, we also talked about environment, you said. So are there any agencies in the environmental area which are taking at the international level this topic?
Yes, I was going to that also, because the World Health Organization is not alone. There are 4 organizations, 4 international organizations actually working together, and they are called the quadripartite, which is a difficult word to say, but the quadripartite, the 4 different organizations, it's the World Health Organization, it's the World Organization for Animal Health, it's the FAO, the Food and Agriculture Organization, and UNEP has also joined now the United Nations Environmental Program. So these four big organizations, they are working together on a global level, and they are approaching it from this so-called One Health aspect, or a One Health strategy, where all the different things are coming together, because when a human or an animal take antibiotic, it comes out in the environment, it comes out in the water, then the animals and the humans, they drink that water, and the antibiotic residues and the resistant bacteria might come back to the humans and to the animals again, and then we have this vicious circle which we need to somehow do something with.
Yes.
We'll take a short break again, and then we'll continue our podcast. So you keep listening Acharya 90 FM, your own radio. Today we are having, on occasion of Antibiotic Awareness Week, we are having Dr. Cecilia and Dr. Ashok Tamankar sir with us. We'll take a short break and join you. Keep listening Acharya 90 FM, your own radio. Thank you. That's it. 23 minutes done. 23.45. So we'll have another 10 minutes. Now we'll talk about research. Research is pending, right, sir? रिसर्च बद्दल घेऊ. आता 10 मिनिटं राहिली आपली, 23 मिनिटं झाली.
आता काय करायचं?
आता रिसर्च बद्दल घेऊ.
हो, ओके.
ऑलमोस्ट झाले क्वेश्चन सगळे. वी टॉक अबाउट रिसर्च, व्हॉट इज टू बी डन, व्हॉट इज द नेसेसिटी. तुमचं काय असेल तर मग विचारा. करूया सुरू.
मी त्यांच्या रिसर्च मध्ये सगळीकडे असोसिएटेड आहे. हां, तर मला माहिती आहे, पण तुम्ही विचारा, मग मी त्याला मध्ये बोलतो.
झालं? Welcome after the short break. We are listening to Acharya 90 FM Your Own Radio, and today we are having with us Dr. Ashok Tamankar and Dr. Cecilia ma'am. Ma'am, now I would like to ask you about the research, which is your field. So, what exactly the research work you are doing, and what research papers you have been submitted?
Yes, that's a big question that you are asking now. I started actually working with antibiotic prescribing in different ways, and ways to influence antibiotic prescribing, because all antibiotics do not happen in a vacuum.
Yeah.
They are prescribed by someone, they are
Yeah.
taken by someone. So we try to find ways to influence prescribing behavior.
Okay.
And behavior is a very difficult thing to change, because you cannot change the behavior of anyone else.
Huh.
You can only change the behavior of yourself. So therefore it's important that people feel the need to change behavior. So that is something that we are working on. And we have also been looking at knowledge and attitudes towards antibiotic use and antibiotic resistance. And we have seen that the knowledge is very high in Sweden. In Sweden, where we also have a quite low use of antibiotics, especially among children.
Yeah.
We have seen last year that only about approximately 20% of children below age of 5 use antibiotics in 1 year, which is, compared to many other countries, a very low figure. Otherwise, we have been working also, my work is in global health, so we work in collaboration with researchers in many different countries. And here in India we have had many collaborations since long.
Yeah.
And one part of that has been about prescribing also.
Yeah.
It has also been about the situation in the environment, where we have been looking at antibiotic residues and antibiotic resistance in water. And Dr. Tamankar and I have had several projects and also supervised students, PhD students together. We also had a common PhD student from Vietnam who was also working on antibiotic residues in hospital wastewater. And so there are a lot of different things that we are
And
doing.
you have contributed a lot, I must say.
Yeah, actually, it's very important that if you look at the work of Professor Cecilia, you'll find that she has been working on almost all the aspects of the antibiotics and antimicrobial resistance. Not only that, she is working in all very important countries. She is working in China in a very big way. She is working in India in a very big way. She is associated with projects in Africa, in eastern part of Asia, like Vietnam, Cambodia, Laos, etc. And what's happening because of that, she is able to cover a spectrum of things. Also, not only that, but in different countries, because the attitudes, the way the things are done in different countries is very different. So that is brought to light, and then we realize that how to solve this problem, because you must first understand the problem. If you want to solve the problem, you must understand what is the problem is, and that is where Professor Cecilia is extraordinarily good. She takes different aspects, uses the student, because the PhD students is a very good resource, because they can do a lot of research, and so they can be given different topics, and so that is where her expertise comes in. The other thing is her energy. She is able to move all over the world continuously. She is roving around and solving problems.
I need to interrupt you for a while. Now we are talking too much. First of all, I must say it's very important is that I do not work in all these countries that you are mentioning. I collaborate with people from those countries, and I think that is a very important distinction, because it's the people in the country, they know what is the situation in their country, they know what are the problems that needs research, and maybe they need some guidance when it comes to methods and how to plan the research and the various things in relation to research. So therefore, as Dr. Tamankar said, we have research students from many different countries, and they are registered students at Karolinska Institutet, but they continue to work in their home countries with the problems they have in their own countries. So we call this sandwich students, that they are sandwiched between the two countries, and they travel between, and it's not only so that they learn from us, we of course learn a lot from them. So knowledge, this is what sometimes it's referred to also as knowledge translation, that we translate knowledge, and often knowledge translation is talked about when you translate from the lab to reality, but it can also be knowledge translation from one country to the other. And I think that this is one thing which is very important, to collaborate between different countries, but also to collaborate between different disciplines. Because, I mean, you cannot be in isolation. You need to collaborate with other people. You need to collaborate between... all kinds of people are needed to solve this problem with the antibiotic resistance.
Doctor, now I'll move on to you. You have been joined with Dr. Cecilia for various research projects. So how was your experience collaborating with Dr. Cecilia?
Extraordinary experience. She is a very intelligent person, very hard-working person. She is available to you anytime, and always.
Which were the research projects?
So we have worked on almost all sorts of research projects in hospitals, in hospital wastewater, the behavior of the doctors, behavior of the patients, and hand hygiene. So almost the whole spectrum of it. And the most important thing that has happened because of that is the association, as she very nicely and correctly said, association of integration of different disciplines into amalgamating into one approach, so that we can solve the problem. So we don't ignore something, that this is less important or that is. Everything is important when you want to solve a problem, and that is biggest education that Professor Cecilia has brought into picture for all of us to learn.
Yeah, that's great. And we had a great podcast today, and I thank you on behalf of Acharya 90 FM. Thank you, Dr. Cecilia, and thank you, Dr. Ashok Tamankar sir. For putting
it's also maybe just one thing, since we are sitting in Acharya Marathi College, let me just bring it to notice that the first project of myself and Professor Cecilia, it started with Acharya Marathi College.
Wow, that's great.
So there is a lot of contribution of Chembur and the Acharya and Marathi College to whatever is happening in India.
Great.
So I'm very thankful to Cecilia for that.
Yeah, and we are both looking out for your future endeavors and future association with Acharya Marathi College.
Right.
So thank you again, Dr. Cecilia and Dr. Ashok Tamankar sir, for joining us today on Acharya 90 FM, and we discussed about Antibiotic Awareness Week, which is happening in November. Thank you again, both of you, for joining us.
Thank you very much for giving this opportunity. It is very important that we are able to do something during the Antibiotic Awareness Week, and your contribution is very important for that. Thank you very much. Very kind of you.
You are great helpful for us. So friends, today we had a podcast on Antibacterial Awareness Week, and we had associated with Dr. Cecilia and Dr. Ashok Tamankar sir. So we will come out with a new topic again in the next session. Till then, keep listening Acharya 90 FM. Myself Tejaswini signing off for today. Thank you. Done. Was it okay? Are you happy?
Yeah, it was okay. This
Sorry.
one.
Yeah, that's
was.
okay.
Let's see, we didn't use this one, so
तुम्ही मला रिव्ह्यू द्या जरा.
मला काय एक म्हणायचं होतं की जे काही आपण आता बोललो ते आपण जर का मराठीत पण करू शकलो एखाद्या इंग्लिशमध्ये झालं ना सगळं.